Okay, that's good. You can relax. Okay, so the first point we have LI1, large intestine 1. It's at the 10th of the sphere from the base of the nail of the index finger. That's the Jingwell point. Right here. The Jingwell points will clear heat from the uppermost reaches of the meridian. That's LI1.
You're on camera now.
That's all right. Okay, the next point we have is LI4, large intestine 4. Is in the center of the metacarpal of the second finger, index finger, and this point will be right in the center. We'll work it very similar to lung 10, and you just press here, and then you rotate and pull slightly. And there's depression you'll be able to feel in the point. This point used for headache, cold, flu, fever, jaw pain. Those are the main indications for the acupressure point.
Really works for the headaches.
Yep, it works for headaches, for sure.
It's all my friend Emily already.
It's
Okay.
perfect for headaches.
Next point, LI5, large intestine 5, in between the tendons of extensor pollicis longus and brevis. So if you're not sure what that is, you can have your client extend their thumb. And you extend your thumb.
Oh, sure.
Okay. And so you usually see two tendons pop out. You're getting right in between those tendons, then you can relax. And then here's the point. You press into the point and then angle upward, like so. So when you angle up like that, you get a little bit more sensation working the acupressure point. In LI5, we use for pain in the wrist, falling in the wrist. It's also a Jing River point, so you can use it for diseases of tendon and sinew along the meridian line. And just so you can use this point for some shoulder pain as well. Okay, next point we have is LI10. So LI10 is going to be, or we find LI11 first, then we backtrack to LI10. So if you flex the client's arm, you can see the transverse cubital crease here. And so before you extend, right, you just place your thumb where that crease is, and then you extend. When you work the point, you have to make sure the thumb is pointed towards the ceiling. So if I rotate like this, I'm going to be more in the triple warmer channel. It makes a big difference positionally when we're using acupressure. And then the point's right here. This point is at the lateral epicondyle of the humerus. You use this point for hypertension, high blood pressure, tennis elbow, or a tendonitis of the lateral epicondyle of the elbow. You can use this for pain in the meridian as well. It's a C point, so it'll help redirect chi flow in the proper direction. Then we have LI10, too soon below. So you're just going to go 1 soon, 2 soon below. There's 10. And I'm just going to work into the point a little bit. There we go. So it's LI10. And LI10 used to help circulate chi and blood through the body systemically. And this point is really good for just pain, tightness in the forearm. And you're right on the edge of brachioradialis here for this particular acupressure point. So we had 1, 4, 5, 10, 11, and next we're going to move up to LI15. And this point you're just going to have to palpate for. The easiest way to initially find the point is to bring an arm to this position, bend it to 90 degrees, and then what you'll feel for is you want to palpate for the acromion process. Right now I'm palpating for the acromion process. You can feel it right here. And so what I'm going to do then is I'm going to move just anterior and inferior. And there's a small depression that you should be able to feel when you work into this acupressure point. If you don't feel the space that's supposed to pop out in this position, just raise the arm slightly first, and that'll help to open it up. And use this point for shoulder pain and rotator cuff injury. And then the next point that we have is going to be LI16. Use this point for shoulder pain. If you want to in class, you can find this point face down. I'm just going to find it face up. What you can do is you can follow the clavicle laterally, or you can feel for the spine of this clavicle or scapula and move laterally. And you're going to be in the space in between the clavicle, the scapula, and medial to the chromium process, and basically you just press in to that point. And this point is a good point for shoulder tension, shoulder pain. I use this a lot with gallbladder 21. And then the last point we have is Li20, and the translation of this name of this point is welcome fragrance, because it's supposed to help open the sinuses.
Cool.
You use the point for allergies as well. So right here, you just get in the groove.
Hopefully it's a fragrance.
There's a little depression that you can feel at the point here. And when we work this point, you do a little circular kneading onto the
That
acupressure
one
point.
does work pretty well for opening the sinuses.
When your clients face down and they get face up, sometimes people will get stuffed up. Very easy. The first thing you can do is just knead into that point, Yoko, and then you just sweep underneath the zygomatic arch a few times. Go back to the point here, knead again, and then pull here, like so. And then the last thing you can do is just use scrubbing here and here. You do a little bit longer. It should take about 30 seconds to 40 seconds, but that'll clear their sinuses and they'll be more comfortable on the table.
A lot of times I notice they're face down when they get congested.
Yep, exactly. And then when you flip them,
Oh, when you flip them, you do it.
yeah,
Okay.
that's when you would do it if they're really
Cool.
stuffed up.
Dr. Shaw is doing the needles on me right in those spots. And I've gotten as good a relief or better from those needles than the full-blown sinus surgery I had.
I
Oh.
bet.
Yeah.
So,
Is
Yeah,
there
those
points
points are
under? I know they're
effective.
probably
Yep.
not on this
Stomach
meridian,
three.
but is there? That is okay.
Yep, stomach 3 is
Is
right
there
here.
an angle that you're pressing
Just down and then in slightly.
in towards the nostrils?
You go straight down like this and then I angle in slightly.
Okay.
But it's not much. It's like
Is it right up against the?
right here. No, not
Okay.
right against. It's out a little bit.
Okay.
It's out a little bit. So you press, and when I say angle
There's
in, you
definitely
don't
a dip
move.
there.
You just angle.
Sure.
All right, so let's make